commonly seen in women. Clinical features: muscle weakness that worsens with use and improves with rest. Classically involves the eyes, leading to ptosis and diplopia. Symptoms improve with anticholinesterase agents associated with thymic hyperplasia or thymoma. Thymectomy improves symptoms. Number 2. Lambert-Eaton syndrome. Antibodies against presynaptic calcium channels of the neuromuscular junction arises as a paraneoplastic syndrome, most commonly due to small cell carcinoma of the lung. Leads to impaired acetylcholine release. Firing of presynaptic calcium channels is required for acetylcholine release. Clinical features: proximal muscle weakness that improves with use. Eyes are usually spared. Anticholinesterase agents do not improve symptoms. Resolves with resection of the cancer. Soft tissue tumors. Number 1. Lipoma. Benign tumor of adipose tissue. Most common benign soft tissue tumor in adults. Number 2. Liposarcoma. Malignant tumor of adipose tissue. Most common malignant soft tissue tumor in adults. Lipoblast is the characteristic cell. Number 3. Rhabdomyoma. Benign tumor of skeletal muscle. Cardiac rhabdomyoma is associated with tuberous sclerosis. Number 4. Rhabdomyosarcoma. Malignant tumor of skeletal muscle. Most common epithelial soft tissue tumor in children. Rhabdomyoblast is the characteristic cell. Desmin positive. Most common site is the head and neck. Vagina is the classic site in young girls. Infectious disorders of skin. Number 1. Impetigo. Superficial bacterial skin infection, most often due to S. aureus or S. pyogenes. Commonly affects children. Presents as erythematous macule that progress to pustule, usually on the face. Rupture of pustules results in erosion, dry, custard, honey-colored serum. Cellulitis, deeper-dermal and subcutaneous infection, usually due to S. aureus or S. papillogen, present as red, tender, swollen rash with fever. Risk factors include recent surgery, trauma, or insect bite. Can progress to necrotizing fasciitis with necrosis of subcutaneous tissue due to infection with anaerobic flesh-eating bacteria. Producing of carbon dioxide leads to crepitus surgical emergency. Staphylococcal scalded skin syndrome.